Let me tell you a little bit about what's happening in Atlanta, Georgia. Because if you're going to have major trauma, I hope it happens in Atlanta. And if it does, have a little card in your wallet that says, take me to Grady Memorial Hospital. Fascinating. Ray Matthews is the director of trauma there. And a friend of ours, mutual friend, contacted me and contacted Ray and said, you two guys need to meet. And so he picked up the airfare for me to fly there. I said, I'm retired, Ray's not, so it's easier for me to go see him. So the two of us flew to Atlanta. And he said he had set aside a day. He's a director of the trauma unit at a 1,000-bed hospital. But boy, does Ray have numbers. Because when he left the Mayo Clinic training program and he went to Grady, he knew that he needed to give people vitamin D in the ER. It's one of the first drugs they get. He uses a lot. I didn't want to correct him because he has great data. I would have looked like an idiot explaining to him that he can only 25 hydroxylate about 15,000 a day, so giving 50 is, I thought, heck, he's got the numbers. I'm not going to argue with him. But I did ask him, what are you doing with vitamin C? And these trauma patients, shot 10 times, run over by a car, beaten up by a gang. I mean, they're near death. What do you think their plasma C was? Zero. So I said, what are you doing with C? And he said, well, we give them 1,000 milligrams a day. And he quickly followed that by, Dave, is that enough? And I said, no. And he said, how much do you give? And I said, more than enough. You won't know until you test. So he immediately started testing his patients on admission with a plasma vitamin C, and then every morning at 8 a.m. Less than 2% of the patients had a detectable C, right? Cash flow was keeping those patients alive. The 1,000 milligrams a day that they gave didn't change it. It was still zero. So he did what any good surgeon would do. He doubled it. He went to 1,000 twice a day. And when that didn't work, he doubled that. And he doubled it again. He finally realized you can't move the needle in these trauma patients orally until they've had 4,000 twice a day, okay? And he also noted that on whatever day it was that the C level went from not being detectable into the human range of reference, that's when the patient's crisis turned. And he knew that in 3 days they'd be out of the ICU. His mortality last year, trauma ICU, 3%. 3. It's 25 at trauma centers, level 1 trauma centers. I think he has the best results in America. And he did it using everything else that everybody else was using. And all he added was D3 and C. And he's given the C orally. I've been saying to him, someday you'll go IV. And he said, you know how many battles I had to fight just to get them to D, right? Orally. So he's got the data now. The other quickies, mothers and babies, keep in mind that the placenta, the temporary organ of pregnancy, has the highest concentration of C of any organ in the body by far, because you can't make new cells without C. Babies are all new cells. Organs with the highest C, after the placenta, it would be the adrenals. That's where it's stored. After that, eyes. I tell my patients and the ophthalmologists and optometrists that I train, you can't see without C. And you know what? When you have people who